cognitive reserve has been proposed as an heuristic to account for the fact that some individuals seems to be resilient in terms to Alzheimer's disease. So they do have the pathology in their brain, but they don't develop as much symptom as you would expect given their pathology. So it seems that their brain has, for some reasons, has developed, is particular and can resist to the disease. And interestingly, these individuals seem to have some particular lifestyle characteristics. They're more educated, and they've been enrolled in engaging cognitive activities. So perhaps what happens is that these activities that they've been through during their life actually change their brain function or structure and make them more resilient. So we're interested in trying to determine the mechanisms that protect them, and in perhaps trying to see whether we can develop non-pharmacological intervention that would increase the reserve capacities in people who didn't have the chance to be more educated or to have cognitively stimulating experiences during their life. So our interest was to try to see whether the mechanisms that underlie cognitive intervention, because the cognitive intervention are provided later in life. So are we able to yield the same mechanisms as those that people, are we able to induce the type of brain changes that occur in those who've had these cognitively stimulating activities throughout the whole lifetime? And what we found is that, yes, we actually see processes that are very similar. So people with higher education, for example, seem to have larger brain in some particular areas of their brain. Cognitive training increases, actually, probably neurogenesis, and there is increased volume in particular brain areas. Similarly, those who've had higher education also seem to have a more efficient brain system, and they seem also to be able to recruit more flexibly different networks when they are doing tasks. And this is exactly what we found when we provide older adults with cognitive training. So we seem to be able to change the pattern or the structure in a way that is very similar to what happens over the lifetime.